Hi, and welcome to video number 6. When people begin to understand that the symptoms that they thought may have started a month ago or even a few years ago are actually the cumulative result of a lifetime of stresses, they often begin to wonder if their children or other family members might also have subluxations affecting their health. So how can you tell? Well, one way would be concern over symptoms that they have. Not just back or neck pain, but anything less than optimal health. The first thing we should consider is there possibly stress or interference in their nerve system? By now, you realize that pain is often an end-stage symptom of subluxations. So if your loved one were lucky enough to receive an early warning sign, such as headaches or knee pain, you certainly wouldn't want to ignore it. It would be best to get them checked for subluxations right away. But if there are no outward signs or symptoms, there are other ways we can tell. We can ask ourselves, do they have a history of physical stresses? For example, a difficult birth can create subluxations. A significant fall as an infant or toddler, concussions, sprains, broken bones, auto accidents, even ones that seem minor can all cause subluxations. Do they play sports? All sports have their share of stresses and strains, especially high-impact sports like football and lacrosse. We find that kids who train at high levels of intensity for a single sport can develop imbalances in their bodies that create subluxations. And often, we find that our adult patients' spinal damage began from falls years prior when they were horseback riding, cheerleading, or doing gymnastics. Something as simple as using crutches or wearing a boot for an extended period of time can throw the body out of alignment. You might be thinking, well, none of the injuries were major, but it's really important to remember an accumulation of small impacts or microtraumas, such as chronically poor posture or always carrying a bag on the same shoulder, can be just as bad, if not worse, than a single large impact. Another thing you could do is attempt a home posture assessment. Look at your family member. Imagine a line going down the middle, splitting them in half. Do they look symmetrical? It may be difficult to notice, but is their head tilted or turned slightly? Is one shoulder higher than the other? Does one hip seem pushed forward or to the side? Do both of their feet turn out evenly, or is one pointing in or out more? When you look at them from the side, does their ear fall right over the middle of their shoulder, or is it forward slightly? You can also take a look at the bottom of their shoes and notice the wear pattern. Does it look different from one side to the other? And if they lay face down on the bed with their feet off the edge and you hold their feet flat as if they were standing, does one leg look longer than the other? Of course, best of all would be to have an evaluation done by your wellness chiropractors who have the experience to detect the presence of subluxations. Remember, in our office, the initial screening is done at our expense. Everyone should just get checked. Whether or not they need or even want chiropractic care, it's a good idea to just know their status. If you have a loved one that doesn't live near us, please ask. We would love to help them find a great chiropractor in their area, one who does not just focus on treatment of a symptom, but truly cares for the whole person. Have a great day, and we'll be back next week with a video about your choices in care.